rash, constipation, back pain, anxiety, insomnia, somnolence, difficulty in breathing, impotence. But I know what you're thinking, because you're new doctors. You're saying, it's okay. We've got drugs for most of these symptoms. Can you see this? Okay, so no more. We're going to start this. Trade school training. High blood pressure does not cause strokes. Weakened blood vessels and blood clots do. High blood pressure does not cause heart disease. Deficiency or toxicity, lack of oxygen to the heart causes it. High blood pressure does not cause kidney disease. Medications cause it, or deficiency or toxicity. Does this make more sense now?
Yeah.
Yes.
Can you see why I put it in twice? I know, I just love this. Okay, now, let's look at how your body can handle blood pressure. What's normal? First off, if you're straining, under that, blood pressure can be 400 over 200. That's normal. See, my system is designed by God. It's incredible. I'm self-regulating, self-healing. I actually have more energy than matter. And my body can generate blood pressures of 400 over 200 when I'm lifting weights. That keeps my muscles strong and oxygen going to my brain. Now, if I'm standing in front of a group of people talking, I could have blood pressure of 250 over 160, just like I do when I run upstairs carrying packages. Amazing, aren't I? And so are you. But you don't realize that. You are made in the image and likeness of God. That is not a lie. That is a truth. Okay? Resting blood pressure, my blood pressure will go down to 100 over 60. If you have diabetes, your body requires blood pressure of 160 over 100. But how long are you going to have this for? Diabetes can be cured in about 30 days. So as you get your body healthy, blood pressure will go down lower. Heart disease, we just read that study, it has to be greater than 160 and greater than 90 in order to keep your body alive while your body's healing. Can you see what's a normal heart rate? There isn't one. This thing is foolish to gauge your life or your therapy on. It changes throughout the day and throughout your life. Okay? Does that make sense? Yes or yes?
Yes, yes.
Good. My work is almost done here. This is the craziest machine in the world. Guaranteed to lower blood pressure when medications fail. Do me a favor. Take a deep breath in. Blow it out. There, I just saved you $300. Okay? That's okay. We'll take, 10% commission check. What I just did is I showed you what this machine does. It causes you to listen. It actually has a band that goes around your tummy. You breathe in, you listen to a tune. Do-do-do-do. You exhale, do-do-do-do-do. Okay? What it does is it's a prettier tune than that. Okay? But that's as good as I can do. Okay, but what it does is it causes you to breathe deep and slow for 15 minutes a day. Here's the science. You breathe deep and slow for 15 minutes a day. Within 3 weeks, you're off of your blood pressure medications, and your blood pressure lowers. Wait a second. Breathing, doesn't it have something to do with heart output and blood pressure?
Yeah.
Oh, wait a second. Does breathing increase oxygen to your system?
Yes.
Oh, wait a second. What about fresh vegetable juices? Would that increase oxygen to your bloodstream and help lower blood pressure? Oh my gosh, I think we're onto something here. Maybe we take care of the body, it heals itself. Wow. Okay, 300. I actually bought this machine. Okay, I used it, and it worked for patients. Finally, a nurse said she's moving to Arizona. Can she have it? And I said, sure, I'm done with it. Go ahead. If you need this thing to help you deep breathe, go for it. Stress reduction, exercise, diet. Okay? I don't see medications anywhere on here because to take medication to lower blood pressure is foolish and ineffective and unscientific. It is. It's just that. The problem is you can't stop them. You have to slowly reduce them. To stop an aspirin a day, if you stop that, you can put your heart into ventricular fibrillation. It's very, very dangerous. British Medical Journal did a great study on that. The problem with stopping medications is there's no science. There's no science to tell you to take two drugs together. And I just showed you the science involving one of the blood pressure drugs. There's no science that says you should take it longer than a year. So you have to, it's up to you. It's up to you to take charge of your health. I will do everything I can to help you, but you have to take charge of it. Monitor your blood pressure. We'll pass these out like they're candy, although they're worthless. Okay? Monitor your blood pressure, slowly get off of it, strengthen your immune system, and your body heals itself. Here's a patient. Ray's been with us now for about a year. 12 years of medications, 12 years of blood pressure medications. Okay, now do you think he was only taking one? No. Okay, now 12 years of taking a diuretic, a beta blocker, ACE inhibitor, all of these different drugs. What's the rest of his health like? He started to develop other health problems. No, doc, comes into me, he says, I can't stop taking them because my blood pressure's too high. I said, yeah, it's supposed to be high. Look at this. You've got pressure on that central nervous system. Of course it's going to be high. Ray, stop him. No, I can't stop him. My doctor says I got to take him. Ray, stop it. No, I can't stop him. My doctor says I got to take him. How many times do I got to be patient to go through this tennis match? Okay? Want me to tell you? Every patient. So, within 90 days, and this was just about 2 months ago, his nervous system radically changed. He eliminated his blood pressure medications. Now he comes up here. I think he's on his day 20, day 21, and he goes like this. Ray, shout it out! Yeah, 20 days after 12 years of taking it. Yes! On the mountaintop. Can you see a difference there? Okay. Fire the trade school guy. Understand your body is designed and built by God. Okay, the best way to start is to do this. You got to get your nervous system checked. We still have a few days left. It's really expensive to get checked at our office. In July, we charge $4. That covers x-rays, exam, physical. Okay, a report of findings. If I find subluxations, we even get you adjusted. Yeah, or a double latte costs $4.50. I know, it's ridiculous. That's why, if you're visiting from out of town or the state or the country, by God, send them in. We'll get them checked. We'll send them home with the x-rays. Because why? Because we can save a life. Okay, that's cool. Okay, so get checked. You need to get regular exercise, not to look buff, but to detox your system. Okay, 20 minutes a day is fine. Proper nutrition, this means if man makes it, don't eat it. If God does make it, eat it. It's good for you. Well, I already showed you the cure for diabetes, just going raw and vegetarian. And sufficient rest. Last week we talked about how to get rest. Now next week we're actually talking about diabetes. Now this is going to affect about half of our population. It's 100% curable. Type 2 is. Type 1 is about, they say 70 to 60% curable, but type 1 diabetes is generally caused, and it's an autoimmune disorder, and we'll talk about the causes of that. But if you could cure 95% of all diabetes, that would be cool, yes?
Yeah.
Okay, good. If you knew the side effect of diabetes drug is early death, curing it would be better than taking the drug, yeah? It doesn't take a rocket scientist, although we have a rocket scientist here. Okay, next week, diabetes.